My name is Dr. Chung. I'm a urologist at Brisbane, Australia. I'm one of the very first andrologists who work in Australia. So my personal interest is in voiding and sexual dysfunction. And I have a very big practice from a prosthetic reconstructive point of view. I think it's very important to understand that penile implant surgery is a very personal thing for a patient. It's important to understand that patients are usually quite scared and sometimes embarrassed to seek help from that perspective. Certainly the idea of surgery can be very confronting to a lot of patients. So if I'm a patient, I'm looking for a surgeon that do penile prosthetic implant, I really want to know that the surgeon is credible from that point of view. The surgeon really have good academic criteria. The surgeon has a very large volume implant, and the surgeon certainly have good patient outcome whereby I can get second opinion. So I'd like to find out from the surgeon whether they have any patient that have undergone the surgery. They're willing to act as a referee to tell me how the operation went. Because as a whole, being a patient is a very scary thing to embark on this journey. So it's important to understand that the patient really want to look at a surgeon that are very affable, surgeon that are very open to them, surgeon that don't overpromise things, because we need to realize that there's a lot of limitation being placed upon what surgery can achieve. So I don't really like a surgeon that tell me grandiose ideas as they can overpromise me and end up being under-delivered. So from that point of view, I really like a surgeon that are very open-minded with me, having an open discussion, and a surgeon that can really look me in the eye and understand what I've been through and understand that I really need help from that point of view. So I really want to see a surgeon that can relate to me on a personal level. I think one of the practices that can relate really well to urology from a surgical point of view is like going to a dentist. When you go to a dentist, you always got this fear that you'll be very vulnerable, and also the fact that you don't know what is going to happen when you open your mouth and the dentist put the instrument into your mouth. So from that point of view, I always find that it is intimidating at the same time that it is intriguing, because I'm scared at the same time, but I'm really interested to know what the dentist is going to comment about myself. So this is probably what I would say, that when I go to the dentist, I really want a dentist that smiles when I come and see them, a dentist that can tell me that, Eric, don't be nervous, relax, Eric, I'm going to be here to help you along the way, and I'm going to fix your problem for you. So this is something that I really look forward. I think it's important to understand that if I'm a patient, I need to be able to understand what the patient goes through. So from my perspective, what I really want to do is to try to make my practice something that patient can relate to. It's a place where the patient feels comfortable, at the same time patient feels confident that I'm actually going to be the best surgeon for them. So what I really want to do when I see a patient is to, number one, try to relax, get them comfortable, and number two, tell them in a very friendly manner that, look, we understand what your problem is, and I think I will be able to help you from that point of view. And then it's really trying to develop a rapport with the patient so that we can have a sense of together in a journey where I try to deliver the patient to a better place in their life and the health point of view. So from that perspective, I usually say to the patient, my name is Dr. Chung, I'm a good implanter. If you need a second opinion, I can refer you to my patient that can give you a good report about what has been gone through. And also at the same time, I keep a very open line of communication. So the patient always feel like they can always call me, or at least call my secretary to get in touch with me if they need to find out more information. It's important to understand that when the patient comes to see me, I'm basically trying to empower them with all the knowledge that they can have so that they can make a very good informed decision. And then from then on, it's a matter of us taking the slow step to try to get the patient ready from a mentally point of view and also from a physical point of view, so that by the time they actually go to the surgery, the patient know exactly I'm the right person, and when they wake up from the surgery, they know they're in the right track. So this is what exactly I'm trying to deliver to the patient.